In this video, I'll be talking about mouth breathing, ADHD, and whether or not maxillary expansion can fix one or both of those issues. So let's go. Hey guys, this is Dr. Robert Passamano. I'm a board certified orthodontist. Today we're going to be talking about maxillary expansion and whether or not it could help with mouth breathing and or ADHD. ADHD is a medical term. I am not a medical doctor. I'm an orthodontist. I help with mouth breathing using expanders. Expanders can widen the nasal cavity and therefore it helps with mouth breathing. I will go into more specific detail how that works, and sometimes this overlaps with ADHD symptoms. So let's learn a little bit more about mouth breathing and ADHD. If you do a Google search of ADHD and sleep disorders, you might find that a lot of these kids are being misdiagnosed. You can see a couple headlines on the screen. The literature suggests that mouth breathing may increase a child's likelihood of developing behavioral problems resembling ADHD by 40 to 100 times. That is a huge number. The Sleep Health Foundation reports up to 75% of children with ADHD struggle with sleep. So if there's a Venn diagram, ADHD and mouth breathing / sleep issues, they overlap so much. So how do you know which one is which? And so Google also says that mouth breathing and ADHD can share some common symptoms such as brain fog, mood swings, irritability, distraction, and quick temper. These symptoms can lead to a misdiagnosis of ADHD in children with sleep disorders. So let's kind of go through that whole process now. Okay, so what causes mouth breathing? Nasal blockage, where you can't breathe through your nose. Sometimes it's adenoid or tonsil blockage. That's like the back of the throat. Allergies, that causes inflammation in the nose, respiratory infections as well. What that results in is a low tongue position, because if you are breathing with your mouth open, your tongue is not at the roof of your palate, it is a lower position, and so therefore the maxillary arch will become more narrow, and it also narrows the nasal cavity. Remember that the maxillary arch and the floor of the nasal cavity are the same, so if one goes big, the other one goes big. If one goes small, the other one goes small. Mouth breathing leads to lower oxygen levels in the blood, unfiltered air into the body, and that negatively impacts the child's mental development. And so structurally what will happen is you will get a long, narrow face. So we don't like that. You've probably already seen some kids that look like their face has been kind of like squished together. And so the diagram at the bottom, this shows that we have nasal breathing. This is the good way on the left, and then mouth breathing here on the right. We don't want to do the one on the right. Here's my slide from the other YouTube video about the top 3 reasons for maxillary expansion. Number 1 is jaw development, reducing crowding. Number 2 is crossbites and narrow arches. You can correct like a jaw asymmetry. And number 3 is more of a secondary benefit, and that's airway and breathing. Remember, increasing the maxillary arch width also increases the nasal volume, and that improves breathing. And I'll talk about adenoids at the end of this video as well. Here's an article from the American Journal of Orthodontics. It says that rapid maxillary expansion not only reduces nasal obstruction, but also raises tongue posture and enlarges pharyngeal airway. Here's an article from Angle Orthodontics Journal. The results of the study showed that when maxillary expansion is performed in subjects that have posterior crossbite, oxygen saturation improved. In this American Journal of Rhinology article, they demonstrated that maxillary expansion is effective in widening the nasal cavities, and it also improved nasal breathing after palatal expansion. The consequences, of course, increase in nasal size. There are just so many articles that demonstrate that maxillary expansion increases nasal airway. I don't think I need to talk more about the benefits of it. So let's go into more real-life examples of my patients. All right, here's case number 1. We have a 9-year-old male. Health history says sleeps with the lips parted. That's called mouth breathing, where you can't close your lips when you sleep. There's a narrow maxilla. When I did a measurement, it is 30 millimeters. We like to see about 36 millimeters. There's a simple at-home test you can do that sometimes I do in the office, where you close your mouth, or you put your hand over your mouth, and then you breathe through your nose. And then if your nostrils flare, that means that the velocity of air is too great for your nose to handle, and that's usually why you breathe through your nose or you breathe through your mouth. This patient did not have any dental crossbites, so sometimes as an orthodontist, I would look at this and I would say, well, there's no dental crossbites. Maybe we don't need a maxillary expander. but for the reasons of medical issues, then you would do this. This patient also has a V-shaped palate. You can see how high vaulted this is. It almost looks like an upside down V. So this is a reason to do maxillary expansion to help with the breathing. So after 9 millimeters of maxillary expansion, this mom wrote to me that she has definitely noticed a difference and that he can breathe with his mouth shut, which he's never been able to do. That alone has been worth it. She's been on this journey for years and very happy to found our office. This makes me feel great that I am helping this individual breathe through their nose, which I know the benefits of it, and this is amazing. I feel great when this happens. Here's case number 2, maxillary expansion. This patient has the droopy eyes or that tired eyes. You can see this patient has a 27.8 millimeter intermolar distance. Ideally, it's supposed to be right around 36. And a well-positioned maxilla can help lift the eyes and give cheekbones a full, healthy look. A droopy-eyed appearance may indicate maxillary insufficiency. So in this case right here, we can see that the eyes look more lively after the expansion. It's a small difference. Like, I'm not saying it's a huge difference, but it's a small difference. And I know this patient is breathing much better when he sleeps. A very common x-ray that orthodontists use is a cephalometric x-ray. This is the x-ray from the side of the head. It can measure jaw position, lip position, kind of like the angle of the teeth. And it also does show airway and adenoids. And so this blue circle you're seeing right here, that is the adenoid tissue. I know adenoids are a 3D object in the pharyngeal area. This is a 2D x-ray, so I know it's not perfect, but this is used as a screening tool. If I see that the airway is blocked by the adenoids, I might refer to the ENT for further examination. On the right side, this is an open airway. You can see how wide open this is. The left side, it's more narrow. It kind of constricts. And this could be a cause of mouth breathing. And so it would be wise to go see an orthodontist to get this screening x-ray just to see, hey, do we have any airway issues? In this lateral cephalometric x-ray, a 5-year-old boy was referred to me just to have a look at the adenoid tissue and airway just to see as a screening tool. You can see that we have complete blockage for this patient. This is not normal. I rarely ever see this, but I just wanted to show you that this is what complete blockage looks like, where the adenoid tissue is touching the other side, so this patient cannot breathe through their nose. And so this is a, as soon as possible, referral to the medical doctor, ENT, to resolve the issue for evaluation and so forth. So the right side, of course, this is the open side. Here's the final case I'll go over. 9.5-year-old female, history of allergies and respiratory infections. We have a narrow maxilla. You can see it's 30 millimeters measured digitally. Ideally, it's supposed to be 36 or more. We have a narrow maxilla. We don't even have enough space for all the teeth. You can see that the lateral incisors are crowded out. So we don't even have enough space for all the teeth to come in. That's called insufficient arch length. And then when we do the visual tonsil examination, you do the open and ah, you do the little tongue depressor, you shine a little light in there, and you can see how much of the tonsils can occlude the back of the throat. This patient was at 70%. So in the back of my head, I'm thinking, okay, we have a lot of tonsillar tissue. Sometimes we have a lot of adenoid tissue too. Those kind of correspond with each other. And we have a history of respiratory infections and allergies. This is a case where we might consider doing maxillary expansion and tonsil and adenoid removal. That's, of course, we got to see the ENT first, and they're the ones that are going to recommend the removal. And here's the before and after of the tonsil and adenoid removal. The parent said that, Dr. Passamano, you're right about this child's adenoids. We saw the chalk ENT today. He said that she is 90% blocked. That's the adenoids, and recommends surgery for removal. He put a camera down her nose and looked at your imaging. So the left side, you can see the adenoid blockage. It's very narrow over here. She's a mouth breather as a result of the blockage. That's adenoid blockage and tonsillar blockage. And then this is the afterwards. This is about 2.5 weeks after the surgery. Of course, it's going to level out. This area over here is going to go away. But they removed pretty much all of the adenoid tissue, and so now we have a wide open airway. This patient is breathing much better. So we did the maxillary expansion and the tonsils and adenoid removal. This is a great option to change your child's life so they can breathe so much better, better cognitive function, better everything, better night's sleep. You know all the benefits of good night's sleep. All right, let's do a quick recap. So up to 75% of ADHD children, patients struggle with sleep. So that's the Venn diagram where there's so much overlapping, you don't know which one is which. And so maxillary expansion and or tonsils and adenoid removal can help eliminate some of that. So that way you can isolate the real issue. So that way you know exactly what you're dealing with. And so did the ADHD cause the sleep issue? Or did the sleep issue cause the ADHD? That's the chicken and the egg concept. We don't really know which one's which. The whole goal is to try to solve one of them and then eliminate the other one. Process of elimination. That's kind of the way I like to do things. So what can orthodontists do in this situation? We can screen and treat the breathing issues. That's what I do. That's what I try to do. It's most effective in the ages of 7 to 12 years old because that's when the tonsils are the most. That's also when you could do the maxillary expansion. Maxillary expansion is usually best around that age because the mid-palatal suture is not fully closed. Of course, you can do the maxillary expansion a little bit later in life, but it's also harder at that age. It's really easy at this age. So what do? We do cephalometric x-ray. That's how we can see the adenoids. We can see the airway. We do a visual exam looking at the tonsils. We do maxillary arch measurements. We just take a ruler and we can see how far apart those intermolar distance. That's the first molars. We ask some questions about the child's sleep. Are they breathing with their mouth open? This is also good for the parents to, actually look at your child to see how are they sleeping throughout the night. And then the orthodontist, we work with the sleep physicians to get these kids back on track, make sure they can breathe, develop normally, and so forth. So this is the whole recap of everything. So hopefully you guys like this video. Thank you guys for watching the maxillary expansion to help with mouth breathing and or ADHD. If you guys want more information about the negative side effects of mouth breathing, there's this book called Breath by James Nestor. It's great. It shows you a lot of information about what mouth breathing does to you. If you guys like the video, don't forget to like and subscribe. Don't forget to check out my other videos on maxillary expansion. That's the top 3 reasons. And I'll see you on the next video.